I was going to ask you this earlier, see, and I totally forgot. But I wanted you to clarify a little bit about what chiropractors do, because you kind of mentioned it in the beginning, and you kind of said,
Mhm.
"Oh, people think chiropractors are like masseuse or things like that, but they don't realize that they're actual doctors." So,
Yes.
could you give us a clear picture of what chiropractors do, and when would somebody need to see them, and for what reason?
Okay. So chiropractor, so like I said earlier, we adjust joints of the back. That's what we're mainly known for. So the spine.
Hmm.
However, we also, like I said, we also do extremities such as hands and legs, feet, ears, jaws. So that's where the stroke patients come in. However, whenever we adjust, because there's nerves, blood vessels, um, and there's muscle attachments to the spine, when we adjust, because the spine has rotated,
Hmm.
turned, or whatnot, um, that's where we come in, where we push the bone. You can say, if I want to say it, you can adjust or push the
Hmm.
bone back into place where it's supposed to go so that it's aligned again. So if you can compare it to taking care of a car,
Hmm.
if you don't get it aligned again, and
Hmm.
it's not gonna drive how it's supposed to drive. So something similar, if that's the way I'm gonna compare it to, it's like a car where you tune it up. So we do is you can say we adjust the spine to just help you get back to where you are, where you can function at your optimal level.
And when would patients come to you? Is it just so, like you said, when they have some back issues, some spine
Mhm.
issues, and things related to that area? That's when they would come to chiropractor.
Yeah, when we see them the most is when they've suffered from trauma already.
Mm,
So because we're in Minnesota here and there's like slip and falls because of the snow,
right.
you'll slip and fall and you'll more than likely land on your butt,
Hmm.
but you don't realize that your butt or your sacrum might have subluxated or moved out of place.
Mm,
So then they don't realize it until they've fallen, and then 3 days later they're stiff and then they can't move as
yeah.
well as they used to. And that's when they'll either come to us or just search for help.
Now, so you said you can actually move it back into place. Is that's
Hmm.
for the most part? Wow. Okay.
Hmm.
So, so what does that mean exactly? I mean, are you actually moving some bones into place, or what's being moved into place?
So it's bone against bone. I don't
Uh huh.
have my spine with me
Uh
here,
huh.
but you can just say, so like a joint, like how you crack your knuckles
Right.
and you hear
Right.
that click.
Mm-hmm.
That's you can say that's I can compare it to an adjustment where you hear that subluxation or that joint pop.
Yes.
So that's how it is. You can say moving, but we just say adjustment
I
because
see.
we're just moving the bone back into place.
I see. And what the key there is the joints, right? I mean, you're
Yes.
you're really focused on the joints, right?
Yes.
So like
Mhm.
somebody fractured their forearm or something like that, right? That's
We won't
not
be able to help. Nope.
right.
Nope.
That's not your area of
Yep.
expertise. Okay, perfect. Okay, good. That's helpful. Helpful for me
Okay.
personally. That gives
Uh-huh.
me kind of a good idea, and hopefully our listeners as well.
And,
Um,
and I
yeah.
think your thing about saying how I mentioned that some people think that we're masseuses,
Mm-hmm.
it's because sometimes because the muscles are so tight because you fell, for example,
Mm-hmm.
it's stiff, it's tight, it's sore. Then we do some soft tissue work to
Mm-hmm.
help loosen those muscles and then adjust the bone to place. So I think because of that soft tissue work that we do,
Mm-hmm.
some patients assume that we just do massages, and
Right.
that's not the case.
I see. Are masseuse and massage therapy is that part of a kind of an overall treatment you would recommend somebody? Is that
It
yeah?
it can be
Mhm.
because a lot of offices they do have massage therapists in the offices
Oh,
to help with
okay.
that.
Interesting. Very cool.
Yep.
Do you have one at your clinic?
No, I just do it myself.
Oh, okay. All right. There you go. I wanted to ask, you the clinic that you and your husband run, is it just you two? Do you have other chiropractors there with you?
Just us currently.
Okay, is
Mhm.
you guys kind of looking to get more? I'm just kind of curious what's the
Yep.
vision of your guys' practice?
As we grow, yes,
Yeah.
as we get busier and we grow, we will include more people, get more people, but then right now the workload is it's it's doable, so it's just us for now.
All right, cool.